Karibu. Kabla tuanze kukaa, naomba national anthem. Alafu baadaye ni East African anthem. Fursa yako, Your Excellency, naomba maombi mafupi kutoka kwa Pastor Seth Akwa Okindo.
Let's pray. Our loving God, Father in heaven, we come before the throne of grace this evening with thanksgiving because of what you have done for us. We ask that you lead us in this meeting, and in a very special way, Lord, we plead that you continue blessing our Governor, His Excellency Paul Simbarati, and the entire leadership of this county government. We also pray that you bless the workers of this county and bless every member of this county. Be with us in this meeting to the close. We plead all these things in Jesus' name. Amen. Thank you so much.
Naomba kurudisha kipasa sauti kwa our county secretary.
Your Excellency, welcome. Our Excellency, the Governor, Kisii County, Paul Simbarati, the Deputy Governor, the Leader of Majority, the CECs present, the CEOs present, the Directors, the Union, and all our guests. Good afternoon. Good afternoon once more. Allow me to take this opportunity at this time to introduce the members present with us here today before we move to the next program. Allow me at this time to introduce, they'll stand and wave, introduce the directors present with us. Our directors, wherever you are, stand and wave. Thank you very much. Our CEOs, chief officers, wherever you are, stand and wave. Thank you very much. Our CC members, mawaziri maalumpo, musimame, you wave. Thank you. The union, maalumpo, I know you'll be guided by our CC member, health, but maalumpo muteza simama, you wave. The union members, thank you very much. I think these are the officials who have just come to grace the occasion today, that we have realized that we have taken some time without meeting here as a big team. So at this time, you can only allow me to call our CEC Health to take the program from the health section. My brother, karibu sana.
Your Excellency, Governor Kisii County, Honorable Paul Simba Arati, Your Excellency, Deputy Governor, Honorable Pepo, the majority leader who is with us here, Honorable Moracha, my colleagues, CEC members, chief officers, directors, med-soups present, and the unions. Colleagues, good afternoon. Muko na furaha? Na kimubwate ndamwamuga? Kono kama na hapa kwa department hapa subati mura yani moko wala kibisha kama na nae kiriateke keiga. Ladies present yani yokoda kananga mubwate ngareka. Okay, Your Excellency, today the department we are humbled that you found time from your busy schedule to come and grace this very important meeting that is basically meant to encourage and talk about the general welfare of our healthy workers working in the Department of Medical Services, Public Health and Sanitation. So we are so humbled, we are so grateful for your coming, and we look forward the kind of love that you have shown this department will continue to blossom as these officers continue doing what they know best, offering services to our people in the great county of Kisii. Nawashukuru sana my brothers and sisters, health workers present, for the wonderful work you are doing. And as a department, and as the head of this department, I want to assure you that we are ready and committed in addressing your welfare and the kind of synergies, the unit of purpose that you have shown shall continue to be appreciated for the years to come. Na Mungu awabariki sana for the good job you are doing. Your Excellency, because this is your day, allow me to recognize our med-soups who are present. Please, where you are, stand up and wave to your colleagues. These are the officers who are in charge of our labor force, the heads of sub-county hospitals. Asante sana for the good job you are doing. The program officers present, wherever you are, please wave also to the crowd. Program officers in the Department of Health, where you are, thank you so much for the good job you are doing. Your Excellency, today, in the spirit of harmonious industrial relationship, we have our union officials present to grace this important occasion. We have had very wonderful discussions before, and we have agreed in unison that going forward, we shall work as a family together, our people, offering what we know best, that is medical services to our people in the county. So I want to recognize the non-officials who are present. I've seen my brother here. You can stand up, please. You can come and say hi to the team, just for a minute. That is one official from the nurses. Then we have our KHPS present here. We have our clinic officers, and the KMBDU team is also here.
Thank you so much, CC Health, Your Excellency, and all protocols observed. Good afternoon. For us, we are very simple, short, because Your Excellency, we want to thank you so much. And I want to take this opportunity to say what I want to say. I want to say it to you as a friend. And on that context, you know that nurses have reached a strike, which is starting tonight. And I'm requesting you as a friend that let us do things as we had agreed. Thank you so much, and God bless this government, God bless you, God bless nurses, and God bless all of us. Thank you.
Your Excellency, as we talk about the welfare of nurses, what the department has done is going to benefit the biggest number of nurses. Actually, they are going to be the majority in benefiting on the issues that you are going to talk about shortly. So nurses, wherever you are, the Department of Health loves you so much. Allow me to invite a representative of KHPS, Onjeku.
With your permission, Your Excellency, and all protocols observed, I've been informed that I need to be very brief, but allow me, Your Excellency, the Governor, to address about 3-4 pertinent issues. Give me about 3 minutes. Your Excellency, we are here today as a family of medical services. As I stand here as the Secretary of KHPS, this is the biggest body in the medical field that consists of over 17 departments. And I want briefly to address the issue that we have been discussing about. KHPS has been left out for a long time on matters promotions. I know when it comes to promotions, Your Excellency, some departments in health have been since neglected. Some departments have not been promoted, and even those members who have been promoted, some promotions have not been effected. So with your indulgence, Your Excellency, I want to request that this time round, I know this is going to be done in a manner that promotes unity and discourages intercadre department so that we work as a team. We don't want to see a scenario whereby some other departments look superior than others. Your Excellency, I want to say again, there's another issue I wanted to address. Allow me to address it, because I don't want, again, this is the only opportunity that I have. The issue about redesignation. Your Excellency, I want to request that on 1st of May 2024, the KHPS and the other union officials signed an MOU. And we agreed that you were to effect the redesignation of members who have progressed in their academics. Your Excellency, we want to see that effected because most of our members in KHPS have not since been redesignated for some time. Your Excellency, I want to say that as you consider the MOU, also consider the health charter that we signed with you during the campaign at Camel Park, where you promised to redesignate all members without discrimination. So we want to request you, with your wisdom and the power that we gave you that is conferred upon you, to do this as Your Excellency. I know you, with the assistance of your able deputy governor, a wise man, a man of wisdom, a man who listens to us, you'll be able to do this. Allow me also to, Your Excellency, say that KHPS, since 2011, and this I want Your Excellency to note it, I want to talk about the issue about replacements. There is a summary of the interdepartment within the health department that is before you, that I signed personally on behalf of the departments requesting of the replacements. The KHPS members, since 2011, they have not been replaced. Some have exited in pursuit for greener pastures, some have died, some have left the service for their reasons. But we have not been replaced. And Your Excellency, I know you're going to consider this. I want to request that as you consider this, you implement the document before you as it is, because the replacement is not recruitment. The budget is there. Kindly, I want to request that you implement it as it is, so that we enhance service delivery in our county. By the way, Your Excellency, let me tell you that when we talk about replacement, every department is equal, and we have one client, is to serve the people of Kisii County. And therefore, we do not have a superior department than the other. With your indulgence, Your Excellency, consider that with the utmost wisdom. Allow me also, Your Excellency, to request this about career progression. We have our members who have requested for study leaves. I have since received some claims that some have applied, some have scholarships, but they have not been released. Your Excellency, we need expertise. And this is what we need to serve the people of Kisii County. Why would someone be denied a chance? And what criteria is used to deny somebody who needs to go and further the studies to come and assist the people of Kisii County? Finally, Excellency, as I stand here, again, I stand on behalf of UHC staff. I want to request you. The last time I was with the Minister of Treasury, the Honorable, we went to follow the matter regarding the UHC. He advised us, he gave us a very simple advice, that governors have the powers to hire the workforce. As of now, Your Excellency, you don't have powers to fire because we are national government employees. But later, you will have power to fire us. But I want to request that these coming replacements and recruitment, Your Excellency, do not allow these gained skills to go on the drain. In fact, I want to request that as we consider replacements and replacement and hiring of workers, kindly absorb the UHC workers. These people have families. These people have their career progression that is stalled. These people have bills to pay, and these people have an ambition. They have a vision. Again, these people are your brothers and sisters, Your Excellency, and these people are your voters, the bottom line. So consider them. With all those few remarks, I want to thank you for listening, and I know that with your wisdom, all these requests that I've put before you, you're going to consider them. Thank you, and may God bless you.
Thank you, Bwana Oncheku. I want to confirm that I know His Excellency will talk about the issues that you have raised shortly. I want to confirm that these issues that you have raised here are already at the table of our County Public Service Board. So I request you to relax. Tuko kazini. Yes. Na huo ni ukweli. Yes, Your Excellency, allow me to invite the Secretary General of Clinic Officers, Bwana Victor Bwanchete. He will invite his colleague from Nairobi.
All protocols observed. Good evening. Your Excellency, we thank you very much for this opportunity to address you. We have never addressed you before. I think we had organized for health conference the other time, the previous regime, but it never materialized. The SMHS can attest. For this one, I want to thank you. very much. Under the leadership of Deputy Governor, we have been having so many meetings. I want to say thank you. Although we have not seen the list of promotion, we don't know who has been promoted, who has not been promoted. As far as the issues of my people are concerned, a few have been addressed. We want to thank you for that, Your Excellency Deputy Governor and the Governor, and also the Department of Health. So, our state as clinical officers is the strike we had called is not there. Because once the government is engaging you, we cannot continue with the strike. So the strike comes as a result, as the end result when we are fighting. But by the end of the day, we went for a strike for 100 days from March. We never got anything. So thank you, Your Excellency, for guiding the promotions, although we have not seen the papers. And also, one issue that is so thorny in my department, we were told is supposed to be gotten lead in KTRH. Clinical officers are supposed to be removed from KTRH. Your Excellency, these are people who have trained. Like now, a person like me, I did cardiothoracic perfusion. For some time, I've not completed. But I'm sent to Nduru, Nyamarambe, just because I'm a union official. I'm not disputing for a transfer. Minor does not dispute a transfer. Transfers are normal. The employer has a right to transfer people. But let the transfers not be punitive. We campaigned for you. We ate together. But now we are being beaten. So, Your Excellency, congratulations for initiating the promotions. Congratulations for, but you have not, my members have not been designated. I have some anesthetists who are working as clinical officers, but that one we handle because we are engaging. We believe that, Bona Deputy Governor, it will not be an end. Once we finish from here and then you don't pick our calls, you don't engage us again. We need a continuous engagement. I want to call my General Secretary, I came with him. Yeah, I've said about the strike. For clinical officers, the strike that was valid to start, it's not there. And my Secretary General can speak.
Thank you. Your Excellency, the Governor, the Deputy Governor, the CEC President, the Leader Majority, the Chief Officers, all protocol observed, my colleagues in the union leadership, and the practitioners. Bwana Yesu asifiwe. Bwana Yesu asifiwe tena. Comrade power. Comrade power. I'm starting that because the Governor has been a comrade for long. He has asked me whether we have met, but I know we met, and even he has come back nyumbani kwetu mahali nimezaliwa. If you remember the late Gitiba, Mwita Gitiba, your good friend, is my uncle. When you came to bury him, I'm the one who received you. So before you came here, we were in Nairobi. You took care of the healthcare workers and you represented their issues. When you came here to seek for partnership, I'm the one who was calling my people, telling them that we have leadership in you and we have favor leadership. And we said, let's support you. And I must confess, I was in the other camp of UDA because I was the one who was leading the technical team that wrote their manifesto. But I supported you and the Governor Wanga from Homa Bay. Hata makofi kidogo nilisapoti governor nikiwa pande hilo. Sasa ni kwa sababu nilikuwa na imani kubwa juu yako. Na hii imani hatujapoteza. Kwa sababu hii unafanya leo hapa kwa magavana 47 utakuwa labda ni wewe wa kwanza. Hata kama tumekuwa na vita hapa nje kidogo, unajua watoto wasipoona baba wanauliza maswali. Ni vile wanauliza maswali, baba ako wapi? Iza tu tukutane na tuhakikishie mkati wa chai ambayo tutatumia kunywa chai ipo. Na sasa ukionekana, tuna hakika maswali ambayo tulikuwa nayo utatimiza. Na nimesikia yameorodheshwa hapa ambayo pia sitataka kurudia, lakini nitataja tu machache yale ambayo yamenifanya labda kuja hapo. Ukiona sina mara yangu ni General Secretary, but nilikuja hapa kwa sababu hapa ninaita hapa ni nyumbani. Na alafu mimi nimezaliwa hapa karibu. Sasa mimi nikiita hapa nyumbani na governor ameita healthcare workers nisikuje, si mimi nakuwa mjeuri? Basi nimepua hiyo ujeuri, nikasema nitakuja nikae chini nisikize maagizo ya governor. So governor, tukiwa hapa leo wa healthcare workers, ukiwa tunaongea huko wanasema wanajua wakipata fursa ya kukupata utatimiza. Na lile ambalo unatimiza leo ni promotion, lakini wanasema kuna kitengo kimoja hiyo promotion under HR inaitwa redesignation, haijaangaziwa. Redesignation ni wale ambao wamehitimu na kiwango cha juu kuliko vile ambavyo walianza na wanatakiwa kupewa cheo ile ambayo inalingana na hiyo. Na pia na job description ama scope ilingane na hiyo job. Sasa hiyo haijafanywa. Ndio maana nasema hivyo. Kama anesthetists wale ambao wametajwa, tuko na clinical office oncologist, kuna wale ambao wamefanya critical care, lakini bado wako na job group yenye iko chini. Lakini kwa facility wanafanya hiyo kazi. Leo hii kama kuna mtu amefanya cardiology na aenda aone patient na ionekane faili yake haijampatia hiyo job description, governor, huyo mtu ako exposed. Ni kama mimi nikuwe nimejiita mheshimiwa na sina vyeti yoyote ya kuonyesha. Sasa tunaomba vyeti zile ambazo zinaruhusu kufikia hapo waweze kupewa zao, hazihitaji fedha yoyote. It doesn't need any financial implication. So it is our simple request that that can be done. I know we have had some conversation, but it has not been done. But more so, Your Excellency, this is a referral. And if you look along, this is the most trusted referral facility. But tumekuwa na kilio. Hii kilio inakuwa hapa ni kwa sababu referral facility is supposed to have the most experienced healthcare workers. Ama nimedanganya? Sasa kwa ile ambaye imekuja ni kwamba wale wako most experienced wanasukumwa nje, Your Excellency. Na tunashangaa watafanya wapi, watapractice wapi? Kwa sababu ukiwatoa hapo umewacha mwanya. Ile continuum of services inakuwa imevuja. Na nimeongea hata na yule ambaye ni CEO, tulikutana Nairobi, ni vizuri niseme. Ni vizuri niseme hakunisikiza, Your Excellency. Na simshtaki, lakini ukiona hajafanya vizuri utamrekebisha pale nyuma. Si hapa. Mrekebisha tutafurahia kwa sababu sisi Kuria tunategemea hii hospital kama wa referral kwa sababu Migori hatuna hospitali kama hii. Kama na hiyo kufa utakuwa unaua wale huko. Masaa 3 kufika hapa na tukikosa hiyo services tutakufa tu. Sasa tunaomba. Na hata nikija hapa leo nimekuja na book, one of the services for my uncle. In the whole of Migori there is no urologist. But you have them here. But the department ameanza kufanya maneno. Sorry kama nimeongea vibaya, lakini sisi kama healthcare workers we are pro-life. So anything that is stand in between us and for people's life, we have to speak it out. So, Your Excellency, I know also you are the chair of the resource mobilization in the Council of Governors. But tunajua munalia, you have the most workers in civil servant in this country. if there is any contribution which is done, including SHA, it is the county that contributes most. But I must say that you have been left behind because you don't have much say in the social health authority. Ni mimi nadanganya ama ni ukweli? Sasa hiyo pesa ambayo ninasema, ukiona vile ambavyo tumeweka structures, hii pesa itapotelea kwa private sector. Hazina pharmaceutical technologist, hazina clinical officer wa kutosha, na hazina madawa. Sasa kumaanisha hao watu wote wataenda kwa zile private zenye wanajua wakienda atapata mtu ako na kaoski kimoja lakini kuna madawa. Tunaomba employment ya healthcare workers. Hiyo ni ukweli, si ndio? Kwa sababu hiyo isipofanyika, bricks and mortar is not healthcare services. So ni maombi yetu kwamba Kisii inaweza fanya hivyo, na tutashukuru governor ili kwa uongozi, na uongozi wenyewe tunaona inakuja kwa sasa, kwa sababu hata mimi nimeapply sasa kuwa mtu wa ODM kwa sababu umechukua uongozi. Na hii uongozi ikija, ongoza hata hii sekta ya afya, ndio tuweze kukua katika kiwango kingine, na kuja hapa kujionea yale ambayo unafanya. And we have brain people. Kisii imecontribute kwa watu ambaye wanaendesha hata Ministry of Health. Ukweli ama urongo? Sasa ni kwa nini hapa nyumbani tusiweze hivyo? Basi ninaomba na nimesema kwamba uweze kuona hayo. La mwisho, tumekuwepo na utepetefu governor. Hata kama ni ile serikali nyingine iliyokuwepo. Matatizo yaliyokuwa na serikali iliyopita, hata kama ni ya Uhuru Kenyatta, aliyekuwepo rais leo hii anayabeba. Ukweli ama urongo? Tuko na wale ambaye, na sitaki kusema tu ni clinical officer peke yake, kwa sababu hata nurses wako na hata wana mahabara walisimamizi kimakosa. Ukweli ama urongo? Sasa baba, ukija ukipata mtoto hata amembe, unamchukulia wembe, hata kama imemkata unamzuia damu isinyeshe, si ndio? Asiendelee kufanya nini? Kutoka damu. Unamutengeneza, unampeleka hospitali. Hawa wameumia, na tunaomba uwashike mkono governor, na hili itakuwa legacy yako. Urongo, ukweli ama urongo? Mbona mfurahii nikiomba kitu cha mela ambacho kitasaidia? Kwa sababu najua kuna familia ambayo inalala njaa kwa sababu watu mishwa kazi. Unfortunately, they still appear like employee because their payroll is still active. They cannot be employed anywhere. I ask that you cure this, Your Excellency. And along that, kuna wale ambao walisimamishiwa mishahara. Nasikia kuna hata mwezi mmoja. Niko na wale ambao bila kulipwa. Kwa mfano yangu, kuna court order ili nasema walipwe, lakini haijatimizwa, na hii akasema anatimiza, na ninaona mwaka umechongomea kuisha bila kutimiza. Lakini nimepata governor, na nina hakika yale ambayo yamekuwa labda ni kizingiti, leo utatatua. Tumpigie governor makofi. Leo hii watoto wa wale ambao walikosa mishahara at least wataenda kwa choo, kwa sababu tumekutana na governor. Ukweli ama urongo? Ili kusudi wakienda kwenye Christmas wajue kwamba watakula mkati, haitakuwa kulilia kwenye choo, si ndio? Na nikisema hivyo ni kwa sababu employment is about individual, is not about everyone, si ndio? So kama kweli kuna hata kama ni mmoja ambaye ninazungumza na ameweza kuafektiwa na hayo maswala, Your Excellency, the history is there, there is a record. We will submit all the names, and we kindly request with a human heart that you address those few issues, and we build a Kisii that is stronger under your leadership, Your Excellency. I ended there, and I believe if we can have a private time to talk zile ambazo hatuwezi, tutashukuru. Asante sana.
Thank you, thank you.
Chibore.
Asante sana Bwana Gibore. Your Excellency, lazima tuambiane ukweli. You have been in the government. This government has been in existence for 2 years now. Just 2 years. This county has over 6,000 employees. Against those 6,000 employees, the Department of Health is the first department that has received promotions of over 1,000 staff. Letters are there. Relax. You go to worry with dinner. You know, you guys who have done HR, you don't bring letters in public here and you start distributing. You will pick your letters from your department. Yes. From this afternoon. Your Excellency, allow me to invite the KMBDU Secretary General, Dr. Oruenyo, naye aseme jambo. Wanjete, thank you so much. You spoke well. No kwe Anjete.
Thank you, Waziri. All right, thank you. Your Excellency, the Governor for Kisii County, Simbarati, Your Excellency, the Deputy Governor, Mr. Elijah Bebo, honorable members of the County Assembly present. I've seen my friend El Moracha. Officers, directors, protocol observed, good afternoon. Well, my name is Dr. Agre Oruenyo. I'm privileged to work with the Kisii County government. I also serve as the Doctor's Secretary General, Nyanza Branch, KMPDU. I'm a consultant pharmacist specialized in pharmacoepidemiology and pharmacovigilance. I want to be as brief as possible, Your Excellency. With me, I know my chair is around. I'll give him some minutes to speak. But for me, I will be as brief as possible. So first, Your Excellency, I'm really happy to see your whole county government leadership here. That speaks volumes. It shows that yourself and your administration is keen in uplifting the health livelihoods, or rather the health of Kisii County denizens to a higher level. So thank you for that, and we are really honored to see this. We have come a long way, Your Excellency. I remember all the way right from campaigns. As healthcare workers, we overwhelmingly supported you. And I know we have, it happens even in families. As your children, we have differed. Sometimes we have agreed to agree. Most often we have disagreed to agree. But the journey we have come, as a union, we are happy to report that we are making progress. And as the SG, maybe before I forget, usually it's the secretary who pronounces strikes and calls them off. I remember we had an engagement about 8 days ago, and we had suspended the strike, not called it off. But as we proceed further, I want to declare that our strike is now called off officially because of the tremendous progress we have made with regards to the welfare issues touching on our members. From my understanding is that the doctors, quite a number, are going to be promoted. I understand the process has not been completed. Some need to go through a different stage of interviews, which I know I've seen the CEO for the board around. I know the advert is going to be out. And the 30% remaining, I know there's a roadmap. We really pray that before we, or rather as we close the next financial year, the 30% are recovered. Your Excellency, I want to thank your administration so much. All the officers, the ministers, the chief officers, I've seen a majority around. They have really been approachable and available, even on phone calls. That's to do with any consultative thing or follow-up as regards to my members' welfare. Finally, I want to express my special thanks to the DG. I know before he ascended as the DG, used to be the Chair County Public Service Board. He played a key role in helping us sort our differences. I know we had tough negotiations. During negotiations in between, he could pause and give us 5 minutes break. then we could join and keep on negotiating. So thank you so much, Bwana DG. We look forward to having this harmonious working relationship. Finally, Your Excellency, Paul Simbarati, I want also to thank your government and yourself, you in person. You have been very accommodative and understanding. I know in any jungle, who is the king of the jungle? The lion. And the lion sometimes, the antelopes can make noise, throw kicks backwards when they are dissatisfied. But Our Excellency, the governor, has been really very accommodative. And from where I sit, I really see that the issues we have with regard to our welfare as doctors are going to be taken care of. So thank you so much, Your Excellency. With those few remarks, allow me to welcome my chair, Dr. Steve Onyango Ndonga. One or two. Asanteni.
Thank you very much. Honorable Governor, Kisii County, the DG, the CS, CEC Member of Health, esteemed colleagues, distinguished guests, kwa majina naitwa Onyango Ndonga. Mimi mimi ndio mwenyekiti mimi ndio mwenyekiti wa KMPDU Nyanza. And kufikia hapo Kiswahili changu kimeisha, nitaingia kwa lugha ya Kimombo. So it is with immense gratitude and pleasure that we stand before you, Honorable Governor. This has been a very long journey. We are gathered here to honor and acknowledge the unwavering support that we have received from Kisii County. I will not be mincing my words if I say that we have seen leadership, and I am a very big fan of youthful and exuberant leadership. That is where we want to go as Kenyans. As a life member of ODM, I know who to vote for presidency. I know mimi ni kijana ya baba, akiniona mahali nimesema hivi, asikasirike sana. So first and foremost, I extend my heartfelt gratitude to the Governor Kisii County. Your steadfast dedication to solving healthcare workers' issues is immensely appreciated. Your leadership in Kisii County is an exemplar of deliberate and intentional efforts to sort out issues as they are brought to you. That is the kind of leadership that we want in our counties and in the whole nation. To the DG, the CEC Member of Health, and all the leadership in the Department of Health, your support has not gone unnoticed. We thank you very much. Kisii County stands as a beacon of hope in the Nyanza region. As we represent Nyanza region, once I want to say that Kisii County has shown the whole of Nyanza that you can actually balance welfare issues and service delivery. As we speak, Kisii County Referral Hospital is an example of modern healthcare service delivery in this region. And working at KTRH, I have to say that we are a bit jealous. If you want more gynecologists, I think I will apply. As we move forward, we want to confirm that the strike doctors had called that was very unnecessary. It only needed us to sit on one table and talk, has been indefinitely called off. And this gesture is a hope that in future we will not have industrial disharmony just because Oliver Twist asked for an extra piece of bread and the housemaster felt like this piece of bread, why don't we keep it or give it to the cat, or so to speak. So thank you very much, Honorable Governor. Madaktari, siturudi kazi, tuchape kazi tukingoja mazuri kutoka kwa Governor. Thank you.
Asante sana Bwana Ndonga. Orure ma ribogera mate gusiumu oje watamine gasingia twakorire. Inu murira tugwancherana. Ancherana twakorire gasingia. Asante sana Bwana Ndonga for appreciating the good work we are doing in the department and what excellence has done in ensuring these officers have been promoted. Mungu akubariki sana for being open and seeing the truth, what you have done. Your Excellency, without much ado, allow me to take this opportunity to invite His Excellency, is the majority leader, to recognize his colleagues who are present. Brings His Excellency the Deputy Governor.
Thank you, Your Excellency, the Kisii County, Mheshimiwa Paul Simbarati, na vile vile Deputy Party Leader wetu wa chama kuu ya ODM, na Deputy Governor wetu. Kabla sijazungumza, ningependa kumuita chairman wetu wa bunge, chairman wa health, Mheshimiwa Shem.
Thank you, Leader. I will also take this opportunity to thank His Excellency the Governor of Kisii County for holding a meeting such as this one, listening to the healthcare workers. I promise you that Mr. Paul Simbarati is a listening person and for sure is going to address your issues so that we can have a smooth running of the business of KTRH. And therefore, for those few remarks, I don't want to say much because it's not my day. We will support you, Governor, to deliver your mandate so that our people can receive the services they need. God bless. Thank you.
Thank you, Chair. I think kuna waheshimiwa wengine hapa. Mheshimiwa Steve Arika. Mheshimiwa Jim, mngesonga hivi muonekane tafadhali, wale mmekuja wote. Ili tuachie madaktari waambiwe wapewe barua, unajua wanangojea barua. Hata tukiongea mingi hakuna kitu wanasikiza. Thank you. Just a name.
Your Excellency, our Governor, Your Excellency, the Deputy Governor, our Leader Majority, our Chair Health in the Assembly, and all protocols of SAL. My name is Honorable Jim Kenyanya, a member of County Assembly, representing the good people of Tabaka Ward. Thank you.
Yeah. My name is Ronald Ongagachira. I'm representing the good people of Moticho Ward in South Mugrango. Only one thing I can comment. We cannot work on social media. Ama titiri tobasa wakiru. Your Excellency kolegasi aba wakiri yogiti.
Steve Arika, member of County Assembly, Ibeno Ward.
Thank you. Asijui kama wale wanaongea ndio wanapiga, I don't know. Your Excellency, mimi yangu yatakuwa machache sana. Na ningependa kuwahimiza mandugu zangu. Unajua madaktari ni watu wamesoma na ndio nyinyi mnatusaidia. Mkigoma watu wetu watakufa. Na ile kiapo ulikula kuwa utatibu watu, Mungu yule juu anakuona. Hey. Kwa hivyo, Your Excellency, mimi ningeomba madaktari wape nafasi yao, wafanye kazi yao. Na pia nyinyi mkipewa kazi, nafasi yenu mfanye kazi yenu. Fanya kazi ya udaktari. Sisi tuingie kule bunge, tuweke pesa ya madaktari. Vile niliona Governor ametuletea ADP, ametuomba sisi tumpatie pesa ili next financial year aajiri madaktari. Sasa nyinyi mkitupigia kelele na sisi ndio tutaenda na hii budget, jamani, tutakuwa wakorofi huko kidogo. Lakini kwa vile mmeonyesha mwelekeo mzuri na governor ametuomba as an assembly, wikaweka pesa, tupatie governor nafasi afanye kazi yake, aemploy madaktari ili waje wawasaidie. Ndio wale mnataka kuenda shule, hamwezi enda shule nyote muache hospitali bure. Kwa hivyo ndio tunaomba tutapatia governor pesa ili mkienda shule mkue kuna watu mmeacha wanafanya kazi, na mkirudi mwapate pia wanaendelea. Kitu ingine na ya mwisho, Your Excellency, hao watu wamesoma sana. Hata Agri nilishangaa amekuwa daktari, alikuwa deskmate wangu. Agri Orwenyo, chairman, yani secretary. Na nilikuwa namwambia Agri, strike haiwezi leta maana yoyote. Keti, zungumza, mwelewane, msaidie madaktari ili wasaidie watu wetu. Na leadership ya Mheshimiwa Simbarati, mkiketi mkielewana, lazima anatenda. Vile leo ameanza, asiachie hapo, aendelee. Na kuendelea kwake, nyinyi madaktari mtampatia moyo wa kufanya kazi mzuri, ili hata sisi akituomba pesa hatupingi, sababu mnafanya kazi mzuri. Your Excellency, tulitembea hapa weekend committee ya health na waheshimiwa wachache. I can recommend that our madaktari tulipita unnoticed. Tulikuwa tumevaa hivi hivi, wengine hawatujui, but I can confirm wakati tulikuwa tunapita au wangona wanafanya kazi yao mzuri. Ile vitu tu inahitaji kutengenezwa kidogo kidogo. Tuketi chini, tuweke budget, sisi kama bunge tupatie hospitali hii pesa ambayo inatosha, watengeneze mara moja, waendelee kufanya kazi. We need that mother child hospital ianze kufanya kazi kama tunaendelea kufanya siasa. Kwa hivyo wale waheshimiwa tuko hapa, tafadhali tupatiane governor pesa, hajenge hospitali ili hao wangwana wapate hata vitu za kufanyia kazi. Sababu unapata wengine wamesoma lakini chombo cha kutumia ili afanye kazi yake hakuna. Kwa hivyo ni jukumu letu sisi tuende tuketi, tuwapatie pesa ili governor wanunulie materials wafanye kazi. Alafu Your Excellency, mimi wakati niliona huyu daktari alikuwa anaambia watu wa kushangilie. Kuna mwanadada pale yule amevaa miwani, alikushangilia sana. Na ni daktari, unajua madaktari wanakuanga hawajuangi kupiga hiyo nini, lakini alijaribu sana. Kama kuna ile, hata mimi naonanga kuna ile honorary degree watu wanapewanga wakienda kuona president, anaambiwa leo umekuwa daktari. Your Excellency, yule mwanadada kwa kuomba kwetu kama sisi bunge letu la Kisii, kama ulikuwa umempromote, kama alikuwa amepromotiwa grade 1, Your Excellency, tunaomba umuongeze umchukue hiyo nyingine ya juu. Ndio pia wale wengine watabaki hapa, pia next time mtu akikuja anajua kupiga. Kwa hayo mengi na machache, waziri njoo endelee.
Your Excellency, kindly allow me to break some protocols. I forgot to recognize lab techs who are present here, and also our public health officers are also in the process of coming up with their union. I also recognize you, the officials who are present. Mariara insist anataka kusalimia His Excellency. Huyu anakuanga mtu mzuri. I know Montomuya.
All protocols observed, Your Excellency. Actually, we are thankful for this opportunity because actually, as a department, we thought that we have been forgiven so that we are not even part of the medical services. Under the research of your DG and you, I know you remember us. So, as I can say, we have 3 issues as a department. Like now, there is our recognition agreement, which is almost being signed. It has taken some time, but Bwana DG tusaidie hiyo to sign. Another issue, promotion. Watu wetu wamestagnate in job group L. Hata wase wako almost kwenda nyumbani. Tafadhali muangalie tuwasaidie wasiende bila hiyo promotion. The last thing that I also like to say, watu wetu are understaffing. Hata departments zingine ukienda some facilities zimefungwa, there's no laboratory services because there's no staff for the laboratory assistants. Na ukijua sisi ni wale hata wengine union officers wenzetu wanatugonga kwamba sisi ndio watu wa governor. So kama tuko na watu wa governor, tunafaa tuchukue nyama kubwa so that hata wao wasikie uwivu. Thank you.
Your Excellency, we have our Director of Medical Services, Dr. Matiko. Please, 1 second. 1 second, then 1 second, please.
Your Excellency, Honorable Simba Arati, the DG, all protocols observed. Sir, on behalf of the healthcare workers, I want to express my sincere gratitude because I know when we started this process, for me, it was an issue of trust. And as you may remember, Your Excellency, we sat in a meeting and you assured us that if there's a budget, then this process should go on in a very transparent manner and to accommodate all healthcare workers. And indeed, as the Director of Medical Services, that has been my duty. I know we have reached somewhere, we have not completed the journey, but I know the commitment that you gave will be seen through. So here, today, some officers may receive their letters, but again, through the process that is chaired by the DG, I want to believe we'll complete the process of redesignations. And indeed, even for the next financial year, as you committed, then we'll be able to take care of those who may not get those promotions. So mine is to thank you and ask you to continue showing that leadership for us to deliver to our people the health services that we need. Thank you.
Dr. Marita, I recognize you. Dr. Nkware, I recognize you, Director Public Health. Your Excellency, allow me to invite His Excellency, the Deputy Governor, to give his remarks and also invite you to address us.
Thank you, Waziri. Your Excellency, honorable members of the County Assembly, County Secretary, CCs present, chief officers, directors, and all from the medical field, Hamjambo. Your Excellency, I usually have 2 issues, but this afternoon allow me to speak to 3 issues. Number 1, Your Excellency, to join you in this auspicious occasion of addressing the welfare of the healthy workers. I am therefore proud to be associated with them. Number 2, Your Excellency, to confirm that what you are likely to address this afternoon was a product of serious negotiation. Your Excellency, as per your instructions and guidance, we sat for many hours with the unionists, deliberating on the best way forward. Your Excellency, it wasn't easy, but allow me to confirm that what you'll be speaking to, or part of what you'll be speaking to, is a product of negotiation. That therefore means that all the unionists and government agreed to this roadmap. Your Excellency, therefore, we are committed to what was agreed under your instructions, and going forward, all those issues, apart from the promotions you are going to get tonight or this afternoon, we will be advertising others as agreed. So we will keep the word and keep the faith. Lastly, Your Excellency, is to request all present to be upstanding as I welcome you to come and address our people. Your Excellency.
Governor, CCM's President, Chief Officers, County Health and Medical Management Team, Sub-County Health and Medical Teams, consultants, program coordinators, the CEO KTRH, County Director, ladies and gentlemen. It's my pleasure to have this engagement with the county and the sub-county health management teams and health workers, including doctors, clinicians, nurses, and other health cadres. Indeed, it's important to have an understanding on needs and aspirations of our valued county professionals, so as to help address them for the sake of motivation and better service delivery in the health sector. But first, I wish to remind all of us that we are all have a responsibility to serve the people of Kisii in delivery of better health service. Ladies and gentlemen, my administration is keen on solving health workers' welfare as follows: promotions and resignations. I saw this gentleman who spoke last, a good friend from the lab. We're going to, I'm sure, among the letters which are around, your letter must be there. You know, you have been faithful to the cause, and I'm happy to see you today. As I promised, at the time, many of you have said here, at the time of the campaign, I have now to make it happen. The Public Service Board has since conducted a thorough analysis based on objective criteria, including education, years of service, and past promotions, to prioritize the serving staff while addressing and back. And I want to say, promotions is not only for health workers. I have 6,000 workers in the county, and all of them, they are due to be taken through the same process. Some of them, they have stagnated. Some of them, actually, they have left the service without promotion. And most of them who try to be promoted, they are those ones who are promoted over time, accelerated a promotion. But some of the people, they languished because they did not have money, they did not have anybody in the service to compromise. But I'm happy that the current service board has done its bit, making sure, and I hope nobody has gone to them with 10 bob or 20 bob or 1,000 or 100,000 from him for him or her to be promoted. If there is any in the service, let me know. They will go home. Because what of those ones who don't have money? What of those ones who don't have anybody in the service to look for? Therefore, because I gave him this responsibility when he came in the office as the chairman of the board then, and subsequently as the deputy governor, and he has done it, and I'm happy. Wanadij, you did very well, and you engaged the unions, and I can see the results today. Allow me to continue. In this regard, and it's important to emphasize, over 965 staff in the health department are set to get their due promotions in the first phase. This includes 510 nurses, 108 clinicians, 108 doctors, and a number of those ones in other cadres. I want to announce today that nurses, 510. I'm told the last promotion was done 2018. 2019. Wale mko hapa mtahakikisha kwamba raundi hii lazima tutahakikisha kwamba watu wako na roho ya kufanya kazi, kwa sababu we must appreciate you for your hard work. I know there are those ones who are doubting Thomases, who are thinking that there is no promotion. Wangepata nafasi ya kwenda kufanya kazi kwa kliniki huku nje. Hakuna. Yule Mungwana alikuwa anasema eti there is a tonight what? Notice. You better do what? Call it off. Because again, you yourself, you are my good friend. You remember, you were advertised, you were advised with the last regime after you went on strike that you come back, only write a letter and get back to work. You hardened. After you hardened, the consequences is that the 3 years, which is allowed in the law for anybody to be outside, elapsed. You are not an employee of the county. There is no remedy about it. If I do it, I'll either go home. It's between me and you. You go home or I go home. My brother, in the new arrangement, I'll definitely look on how to help the 40-something, the union officials who are dismissed and who are not employees of the county government of Kisii. You were advised accordingly. I've tried to engage you. You have refused. You have been engaged by my deputy. You have refused. We have no remedy. The best thing you would have done, you know, where we can be able to get an answer is through the court. Otherwise, if I do any shortcut, because you are my friends, I'll be in hot soup. I'm a good, abiding citizen of the law of Kenya. However, for the doctors, for the nurses, I want to say this. This is a good number. And today or tonight, I'm told, when a deputy governor, you told me that there is an advert which is going out for the internal competitive process, which people they must do it, isn't it? Job group, yeah, job group Q and above. Hatufanyi promotion ya hii ya kawaida. Hii ni competitive, I'm told. Q and above. Kwa hivyo ninyi advert inatoka leo, of course is internal. Sio mambo ingine. And I know all of you, for those ones in job group Q and above, you are capable. You'll make it. Because that's the law again. Allow me to continue. In the second phase, the remaining load is healthy department will be sorted, just like other county staff in other departments. You people. I was asking Otujo, you know Otujo? Otujo is what are you, Otujo? The chief of staff. He was the unionist. I'm asking, at any given time, did you have a discussion with the former governor? Seated, discussing on issues of health. Ameniambia hakuna. Nataka niseme hivi. Mimi nikiona watu namna hii, nafurahia tu kiroho safi. Hata wale ambao wanasikia mbaya, nasikia vizuri tu kwa sababu wananiongelesha. Kwa hivyo, I want to assure you, I came in when there was no discussion. I came in, found we had 261 drivers against 62 vehicles. Whereas we did not have enough nurses, enough clinicians, enough doctors. It's now I've asked, actually the DG again is leading that matter, that all those drivers and other staff who are idle, I'm told there are staffs here who are actually makangas. Wanakuja asubuhi, wanasign, wanakwenda kufanya nini? Kuendesha magari hapa. There are staffs, clerks, secretaries. My office had 12 secretaries. Saizi niko sijui na mmoja ama wawili. Nimesema wote wakuwe designated ya other departments. You are good people. I'll mention it. later how good you are. Salary delays and other issues. I acknowledge that there has been a challenge in timely salary payment. This is due to non-disbursement of salaries. However, you can agree with me that despite the challenges, we are up to the date on salary payment, unlike other counties with a backlog of 3 or 2 months. We have prioritized to pay salaries ahead of other obligations like payment of suppliers and contractors. Should be told is that the national government has not disbursed money for September, October. But we have made sure with our arrangement with the banks, all of you, hakuna mtu hajalipwa mshahara yake ya September. Kwa hivyo, kuna mtu wa finance hapa? Na wacha niulize tu. Mtu wa finance yuko hapa? I hope kwamba wako wame-apply the payment for October. And again, I want to remind you, we have not received money from the national government, as it were. But sisi kama county, we made sure umeweka mpango, watu at least umefanya kazi mwisho wa mwezi, uko na pesa ya kufanya nini? Ya kununulia mtoto maziwa ama kulipa rent. Remember when we came into the office again, I don't want to, actually somebody said here, the former government, the present, the future, is the same office. I don't want to blame so much the past. I want to say this. In the last regime, these people, they were operating without all minus 1 month in the budget because there was no money. We came in, we have made sure June is paid. 420 million. We went ahead, we got some 250 million within again. That's close to 700 million. Which money was not there to give out for bursaries. How I wish these people, they would have sorted out the issues of the roads and other projects. Today we would have had enough money to do our facilities, health facilities. If you walk around, for those ones who are working here, if you go to our level 2, level 3, they are down. Ni hospitali ambazo ziko mbovu. This roundup, I've asked the MCAs, ndugu zangu, dada zangu, we will give priorities in health matters. Therefore, the supplementary which is coming, I'm setting out a good amount of money in renovating all our facilities. Last week, we signed an MOU with the national government. We are going to have equipment in replacement in all our facilities, level 4s and 5. This facility is supposed to be a referral hospital, but it's not. It's taking care of every person and walk in. All level 4s, again, I want to assure you, God willing, by June, tutakuwa na mashine za kutosha, tutakuwa nimeandika madaktari, tutakuwa nimeandika nurses, clinicians, all other health workers, watusaidia kuhakikisha kwamba kazi imeenda mbele. For those ones of you who are making noise, you are here. I wish you'd have made that noise. Hapa ile ukora ilikuwa hapa ilikuwa kubwa sana bwana. Hii especially this facility level 5. Hapa kulikuwa ni a center of leadership. Hapa even now hatujamaliza, pia kuna wezi wachache hapa ndani. Kuna wezi wachache hapa, and I've been very hard on Dr. Wimeke. Kwamba nowadays we don't handle. Hao wananchi ni kuuliza hapa kama wanalipa cash. Isipokuwa kwamba kuna watu hapa wanashirikiana na wale security team iko hapa, wale askari tumeandika hapa wanatoa wagonjwa ndani. It will come to into the pavilion, especially on issues dealing with KTRH. The other day I was here with the I want to say that I don't know where I am in the support of either Trump or Harris. You know, the reason for Harris to have lost, na mama mnajua mzuri. And you saw Trump got a bigger number from the blacks. Men, not women. All black women were supporting Trump. But they were supporting Harris. Lakini wanaume black walikuwa na support nani? Trump. Kama kuna watu racist dunia hii, kuna watu. Lakini kina mama, Vina? Wewe ni nini? What are you? Sub-county. Where are you best? Bonchari. Wewe ni mtu mzuri. Kuna watoto wangapi? Kuna watoto wangapi? Watoto? 2 kids. Kwa sababu nilisikia wewe kuja. Wewe shika hii. Hii ni $1. Wewe nimeona ni mzuri. Lakini you are going to be promoted kwa hivyo. Kwa hivyo lakini kuna mahali utaenda hapo Central Bank. Utabadilisha huko. Wewe ni mama mzuri, wewe ni mtu wangu mzuri, nimekuona. Haya. Wakati mwingine akili ni nywele na kila mtu ana zake. Wakati wengine walikuwa wanalalamika kule, yeye she was happy on transfers, and I'm happy for Dr. Rwen. Daktari uko wapi? Daktari, huyu jamaa ni mtu mzuri, and I'm happy with your attitude. Vile huko na Bwanchete. Watu wazuri. Tutaongea nyuma ya tena. Ninyi watu wazuri. On transfers, including Dr. Rwen, had transferred him. Not only for any good reason, because I wanted his rich experience in some facility. And Daktari, don't worry. Now that I've seen you, actually Bwanchete, I've been asking, who is this Bwanchete? Kumbe ni mtu najua. So Daktari, on transfers, I want to assure you that the staff transfers are not conducted with malice intent. They are often necessary to ensure equitable distribution of resources and address services gaps across all our health facilities. As you are aware, HR policies on transfer stipulate a 3-year period for transfer of workers, but sometimes, due to urgent needs, transfer can be effected. Therefore, kuna wale wamekaa hapa, kuna mtu naenda kutoa hapa KTRH, analia. Siku hizi hakuna mambo mengi, and we're making sure this place becomes seamless completely on issues of handling money directly. I want to appreciate the SMHs. Hawa ngwana wako hapa. And there is a lady is there. Ama daktari, Dr. Mtunga kuja hapa. Huyu Ogembo yuko hapa. Kuja daktari. Dr. Matiko kuja. There are 2 people here. There is that senior clinicians you are with, South Mugrango. Where is she? Where's Pamela? Mama, kuja. Huyu anaitwa Dr. Mtunga. Huyu jamaa, Mtonga. Huyu daktari leo hii hatungekuwa na yeye. Angekuwa amefanya nini? Amefanya nini? Ameenda. Huyu Dr. Matiko and your name Pamela. These people survive kwa tundu ya nini? Ya shindano. Courtesy of another doctor. Mniambie daktari kama huyo cheke na yeye kwa sababu alikuwa anataka kuua madaktari watatu because of lack of information. Ama hiyo ndio mlikuwa mnataka? Therefore, I stood with these officers. Now we are not going to touch those anesthetic machines. Actually, we have arranged all level 4s will have their own anesthetic machines and anesthesians, all of them. We will be able to refer them back to those places to sort out those problems. Na nashukuru, ninyi mmekuwa watu wangwana. Daktari, baada ya mimi kutoa wewe Keumbu, umeenda Randa. This gentleman, wakati mwingine ni mzuri kufanya shake up. Ameenda ameimprove Randa. Keumbu ilikuwa chini, yule nilileta hapo, amepeleka Keumbu wapi? Where's Dr. Monda? Yes, Dr. Monda, wakati mwingine nyinyi bwana. Dr. Monda, congratulations. Maneno mengine tu. Yeah, Dr. Monda took over from Daktari here. He has improved that facility. Where he went to, this gentleman ameipeleka mbele. Wakati mwingine changes that necessary. Tunashukuru madaktari. Lakini huyu, where is Dr. Gentleman? Huyu alikuwa Ogembo. Samora. Okay. Wewe simama, nyinyi wengine endeni. Huyu muungwana ndiye alichukua kutoka Dr. Who? Samora. Samora, in revenue collection, he was doing around 700,000. Actually, mwisho aliniambia governor, niache kwanza nikae, ni tengeneze hospitali. Therefore, he moved from 700 to around 1 million. He stuck there. But I made changes in that facility of Ogembo. This gentleman moved their collections from 1 million to how much now? To 6.5 million. Daktari, endelea kwa sababu endelea kazi nzuri. I'm so happy. Na hiyo facility tunaijenga, put 300 million in it. Najenga. Wakati mwingine unasikia mbaya, wewe utaki kukua, utaki hata ku appreciate. Say you appreciate this guy. Daktari, thank you. Kwa hivyo niko na many options. Asante sana. You know, we must appreciate these people. Asante. This gentleman, after I removed Dr. Samora has gone for studies. Huyu ameingia, ametoa hiyo pesa hapo chini. Hii ingine ilikuwa inaenda wapi? Ilikuwa inaenda wapi? Dr. Marita Kamia. I've been hard on this gentleman. And daktari, I'm happy. Huyu mtu anapigwa vita kubwa. When we came here, when I changed, the other doctor who was in charge. And we want to say, wakati mwingine ni mzuri, wakati umebadilisha mtu usimweke hapo, akae hapo, ataharibu. Nasikia anakoroga. Lakini this gentleman moved the collections of this facility from 47 million. What do we do last quarter? 235 million. What else could we do? Tupige makofi eti huyo ni ndugu yangu eti hapana. Is for the service of our people. Today most of the doctors here, actually kuna watu hapa wanasema tafadhali governor, kama there is transfer usinitoe KTRH kwa sababu kuna kitu tunaita locum. Daktari, congratulations. Endelea, I'll give you the support. Wewe weka pamba kwa masikio. Fanya kazi. Tusaidie watu wetu. When they came in, Dr. Matiko, wakati mwingine kuja kidogo. Unajua wakati mwingine ni kitu mzuri. Hawa wangwana watu wazuri. watoto walikuwa wanakufa hapa kuzaliwa. 50% of newborns. Ni ukweli daktari? And that's record iko hapo. 50% walikuwa wanakufa hapa. Siku hizi wale ambao yule ambaye alikuwa pia anaua ndiye ataweza kuwa anapiga kelele. Hamjabadilisha yeye. Kwa sababu anashindwa vipi? Una watu unajua, I wonder, but I'm happy, daktari, for the good work. We used to lose 25 to 27, and there's record. There is a record of a day we did not lose a patient in this facility since we came in. What else can we give to humanity? I want to thank those officers who are determined kwamba they have given good services to our people. I'll always stand with you. Daktari, fanya kazi, tasimama na nyinyi. Dr. Matiko, unajua kwanza mtu angekuwa CEO wa KTRH ni huyu. Huyu akawa na wasiwasi, uoga. Hata nikapea yeye akaakti kidogo. Lakini hakujua vile, lakini I'm happy now that is the boss. Yeye mkubwa is the director. Dr. Marita, endelea na kazi nzuri. Kutibu watu wetu na madaktari na nurses, clinicians. You guys, you are doing a very good job. Amjui vile na mapi. Huyu daktari chairman wa madaktari kutoka Kisumu yuko wapi? Daktari, mapi kwamba this is the only facility. I'm going to make sure we have beaten the whole region in terms of service delivery. As long as our wangwana tumeelewana. Asante. Ketini. Kwa hivyo transfers, they are necessary. Ukitolewa wacha kuwa na ugumu. Kweli tu. Inawezekana mahali unaenda there is something you can be able to fix na inaendelea mbele. Nawaambia hata kuna watu pia nilikuja na wao kwa ofisi, pia ni wakora. Lakini pia naangalia siwezi, I can't blink on them. Napambana na wao. Wengine waliresign wiki hii. Wengine wataresign nasikia next week. Nasema afadhali uresign. Mmoja anasema tafadhali ambia governor awaachilie hiyo pipe kidogo. Naambia kwamba mimi hiyo pipe lazima ikauke. I'll make sure it's dry. For drugs, tafadhali nawaomba. Wacha tupe. You can imagine wewe Mungu amekubariki, wewe umeenda shule, akili nzuri. Umesoma, umepewa kazi, uko na mshahara. There is a poor woman who cannot afford even 100 bob. Buy food for the children. Let us save that team. Mwisho, nikubalie niseme hivi. Study leaves. We recognize the importance of professionalism or professional development for our health workers. Already a number of health care staff have been released on study. Lakini pia tunataka tuseme hivi. When we're giving you a study leave, hawezi kuwa you are the only oncologist. Nurse ama daktari will release you. Until we have a placement, that's the only time we can release you. I'll be happy to have many of you to go for study leave. Tafadhali naomba. Kama hujapewa, check before even you apply. How many are you in your department? Hata unapeana unasema kwamba najua tuko 10 na mimi nakujanga nakaa bila kufanya kazi, nikubalie nifanye nini? Ende nisome. We'll definitely help you to go for your further studies. However, the current shortage of medical officers necessitates careful consideration when granting study leaves. Going forward, for rationalization and equity sake, we will be doing assessment to find out areas in need of specialization so that we be doing advert asking interested medics to apply for further study in specific areas. And this one I've given direction to Waziri, your kazi lazima ufanye. For medical cover, this was important. Na wale union, nurses, clinician, kina mtu wa Mariera. Mariera mnakumbuka mkiketi na mimi. Mkiniambia, you guys mnatibu watu hapa. But you are not allowed to access amenity. Unakumbuka? Ulikuwa na nani yule? Wale wangwana? Is it not true? Kwamba clinicians were not supposed, they were not accessing what? Amenity services. Therefore, I decided that let me look for a cover which will allow all my health workers and the staff of Kisii, as long as your job group gives you a certain amount of money, you can access any facility, be it is Nairobi Hospital, be it is Aga Khan, and so be it. I know there's been a challenge with Trident. You've seen an advert which has gone out. We are looking for, again, a reputable insurance company to give us a cover as it were. But there is no time I would want to discriminate, including, not limited, to even a driver of the county. As long as akona cover yake, aende, atibiwe, apate the best, again, services. And I'm happy that this facility here, my former deputy governor, when he got sick, he was treated here. Siku moja, nikigonjeka nataka kwamba nitibiwe hapa. Sababu hii ni hospitali yangu. I must have faith in you people. As long as usindunge na maji. Kuna wengine hapa wako na roho chafu. Lakini nyinyi naona kwamba lakini madaktari, thank you for the good work. Acute shortage of staff. I have instructed the Public Service Board to look into this matter and come up with a matrix to establish the gaps due to natural attrition and have then be filled accordingly. Allow me, as I just indicated earlier, that I'll make sure, God willing, the new year, either from April, May there, we'll be having more staff around, help us to fill those gaps as they were. Kwa hivyo, kama umekuwa ukifanya kazi nyingi, vumilia muda kidogo tu, hapa mbele, itakuwa ni mzuri. Kwa hivyo, we'll employ more nurses, we'll employ more clinicians, more doctors, and as well, wale wa lab, wa Mariela, tuta-employ. I wish kwamba hawa jamaa wangekuwa wametengeneza mabarabara, ningekuwa nimesave enough money to fanye those employment. Allow me to say this. I know there are the politicians from within who negatively talk about our facilities. Nataka niwaombe wale wanasiasa. Kama unajua kuna shida, badala ya kupiga kelele kule nje, kuja tuambie. Lakini kama ni tenders hapa, hapana, tenda tuna advertise yote kwa mitandao. Uliza mtu wako, apply, akipata tutapea yeye. Na ukiwa na uchungu sana, wewe kuja niambie. Niambie vile umedhulumiwa. Tasaidia kuhakikisha kwamba sheria imefuatwa. I don't know if I say, but for the doctors again, I want to thank you. Because the doctors, I pleaded with the department, kawaambia wafanye duty roster, which is like going round in every facility. Dr. Matiko, is that duty roster working? Yeah. The doctors, I want to thank you, kwamba doctors, they arranged among themselves. Leo utapata Dr. Matiko yuko Marani. Kwa mfano Monday kama ana kazi nyingi hapa, siku nyingine yuko Nyamache, ama yuko Susu, ama Ogembo, and that's what we agreed. And I want to thank you, madaktari. Wale ambao mnafanya hii kazi, I'll always facilitate you. Na niko tayari. Where is Dr. Bahati? No, there is a lady that is Dr. Bahati here? Wapi? Okay. When I came in, she the one who asked me for? Yes. Dr. Bahati nilikuja hapa aliniambia for the whole time that she was in hospital here, she had never had a surgery because she did not have what? A safety? No, this is the one for, is it chemo? Wewe simama. You are the nurse there or you are the chief nurse? Oma. Do you have it now? No. Do you have the safety cabinet? Which was going for how much? Kuja tu. Wewe unajua wewe ndio ulikuwa mkubwa, kuja. But the chief and the challenges we had then, and if we have fixed them, so that we can be able to give hope to these people.
For chemotherapy, because if it's not there, the ones who are preparing, they are at risk. They can get side effects. So it is there. Thank you.
Comparing.
Yeah, of course.
Your time and now.
Yes.
How is it?
It's fine.
So. Okay, Dr. I'm told that Dr. Baat is doing some work, and we may get the certificate to run the chemo. And actually, I was being asked yesterday if we do have. Yes. Sawa daktari. Thank you. Afadhali jipigie makofi kidogo. I want to report now that I'm told I cannot issue because I'm not supposed to, but I want to wale mlikuwa na wasiwasi. These are doctors. Promotions. Unajua I've not seen even one. Nataka mnipe makaratasi ambayo hayana. Hawa ni madaktari. Ziko nyingi. Hawa ni madaktari, clinicians wako hapa. Clinicians mko wapi? Ile timu yako iko wapi? Kwa Nchete. Timu yako iko wapi? Kwa hiyo barua ziko, wasiwe na wasiwasi. Where are they supposed to be picking them from? The chief officer. Nursing officers. Nutrition and what? Ethics. Huyo lazima she's due. Radiographers. Mko hapa? Medical lab. Nani? Malaria. Yako iko hapa. Sio yako peke yako, ya watu wako. I hope kwamba huko hapo. Public health. Record officer. Hata record officer mlikuwa mna. No. Kwanza hao usipowapea promotion ndio wanapiga kelele sana, madaktari hawajui kupiga kelele. I want to appreciate the board for good work, and DG, thank you for making sure that this one has come to pass. Good people, I want to live there. I want to urge you people. Let us be, there is nobody else who will fix our time. We must fix ourselves. There is no another person who has been given an opportunity to work except yourselves. Hata kama wewe ni driver, hata kama wewe ni mfagiaji hapo hospitalini, tafadhali, let us give our best. We're going to ease pressure from this facility to level 4s, as I promised. I put good money into it. Much of the money which was lost, I can assure you, we are going to make sure that money is put to proper use. Mother-child is ongoing. Hopefully, after getting the equipment, there is a lot of work which is undergoing. In this facility, nilikuja hapa nikapata mtu amelipwa karibu yote, lakini huyo mtu ni mzuri, nikarudisha yeye. He has worked on this. How far are we, daktari, with this? No. I've seen QS. Amekuwa on site for so long, bwana QS. Kuja hapa. Mtu kutoka bwana amekaa miaka ngapi hapa? Yeah, I know it was raining inside. Naile, because again you are the one who's there. So it's a heavy investment. We have agreed we are going to get machineries, and Americans are awfully that the way they say they may get us some equipment for that facility. We are going to. But this one, we want to extend services of amenity. It's important to note that we are going to extend more services to this place. And we have put in a request. It's important to be noted that we are going to make sure some of the facilities will be brought down. We are putting for more money for another facility bigger than the other one. And Posta to where the regional hub for medical services. I can assure you will be there. Though I want to mention this, there is a contractor. Are you part of Cancer Center? No, but we are part of the team that is overseeing. Where's Dr. Kenan? Nimeona hiyo kazi haiendelee mzuri. I had spoken to the president about that person. Headquarters nimeona wakifunga. Sawa. You are smart. Sawa. Najua wakati mwingine let us appreciate people. Good people want to live there. Congratulations for those ones who have been promoted to next grade. And we have said for those ones who got accelerated promotion, we will take you back to where you are supposed to be. Kuna mtu hapa anasema kama unajua kwamba uliruka one grade kwa sababu ya pesa yako ama kwa sababu ya kujuana na Simba, jua kwamba you are supposed to back where you are supposed to be. Let us be fair. No angels will come and guide us around. We must guide ourselves. And all of you have babies. You expect tomorrow kwa sababu mtu anajua Simba ndiye akue promoted. No. What we have said, and this one is clear. Kama mtu najua kuna watu wako S, they are supposed to be in some position there. Tumesema lazima warudi mahali wanafaa kuwa. Ukubalia watu wengine wafanye nini? Waendelee juu. With those many remarks, I want to leave it there. For who is in charge of ambulance? Name is? James. How many ambulances are working? 6. Initially, we didn't even have one. We had actually to get to, and now hatujalipa St. John's ambulance. Drivers wa ambulance wako wapi? Hebu wekeni mikono juu kwa sababu hata nyinyi I'm promoting you very soon. Weka juu mikono. Wako wapi? Hebu kuja ndugu yangu. Wewe tu uko hapa? Kuja tu wale mko hapa. Yeah. 2. Okay. Najua mmefanya kazi nzuri. Nawaomba ndugu zangu, endelea kufanya kazi nzuri, lakini kuna wizi mdogo hapa. Wizi wa mafuta. We have decided to mount these vehicles with gadgets of tracking, fuel monitoring. It's important to notify you. Sababu sitaki kufuta mtu kwa sababu umeiba mafuta. Kwa sababu kuna wizi mkubwa sana wa mafuta. But you are doing a good job. How are they part of the promotion? All of them. Na kitu mtaweza sema kimoja. Unakunywanga. Mtu mzuri tu. Haya. Haya, wewe ni mtu mzuri. Endelea na kazi nzuri my brothers. Na kama kuna shida, if you think hiyo shida iwezi solviwa na hao watu, wewe kuja tu sema mimi ni mtu wa ambulance, nataka kuona governor. Ongea nijue shida gani. Sasa na muendelee na kazi nzuri. Na pia wewe, these ambulances, unajua they are supposed to be a mini hospital. Ile speed zinakimbishwa hapa nje, hakuna hospitali hapo ndani. Kwa sababu necessarily ni kwamba ukiingia kwa hiyo ambulance unafaa upate, because unafaa upate even a nurse is there. Not the driver. Okay. Good. Kwa sababu it's supposed to be a moving hospital, hakuna haja ya kukimbia vile mnakimbia. Kwa sababu I'm told there is one which was involved in an accident, ikaisha completely. Umebeba mtu ndani who is mahututi, lakini watu wakakufa. But now, huyu mungwana is talking good. Yeah, Mike. Umesema unaitwa nani? James Kimonge. Just state what you have said.
What I said is that previously we used to have serious accidents, and actually we are having 2 vehicles automatic motors which we cannot repair because of some reasons. But during your time, I don't remember to have really acted on any serious accidents.
Asante. What I will ask, and Director, what you need to do, make sure that when it's moving, I told you I was carried once with an ambulance. I found somebody who's attending me is an assistant doctor. Basically, it's a moving hospital. It should be a moving what? Hospital. Tafadhali, ndugu zangu, na wewe ukiwa mkubwa wao, endelea na kazi nzuri. Sasa, I'll give you all the support. Mnataka. Sasa daktari. Thank you. Another thing, ni gani ile nimesahau?
You remind me, wale ambao kama have not addressed an point of concern. Shiv. Until last week. Again. Sorry. Daktari, you remember? I had to call you from Nairobi. I had to bring up this item when it was highlighted in the TV. And the team from Kisumu came here to check. Is it working? Registration machinani. We did try to sort out Kisii. Nataka niwaambie ukweli wa mambo. I've been on these issues with the PS himself. And the PS is trying. PS Kimtai is trying so much to make sure it works, until he had to sanction some people to come over to check on Kisii issues. Daktari, what are you saying?
I want to confirm that you've led in this thing. Because last week you, through your phone calls, the PS called, you gave him my number and he called, and we agreed that the issues we are facing here have to be addressed. And indeed, over the weekend, we had a team. The regional manager for SHA came here, they tried to shoot some issues. Even now, as we speak, there's a meeting planned for next week. I think there were letters out already for tomorrow. I think we've cancelled that until next week, Tuesday, by the same team to come and train our front office officers who are dealing with the NHI to ensure that it is smooth. Further to that, yesterday again, we engaged people from the national government with Waziri, and we'll be coming probably next week now to take care of the registration. It will be a multi-sectoral team. The county commissioner, the health department, and our CHPs who will be doing this exercise at the community levels to ensure that the numbers go up.
Asante. That is it. I've been on top of these things. When Kisii is mentioned, I know that they are talking about me. I make sure I've fixed it. But can I tell you, even in the fatherhood, those who are Catholic here, and even for those ones who go to Kamagambo, ama Uganda inaitwa nini? Bugema. You know, we expect those people to be very holy. All of them. But always you'll find there is an element, hata yule ambaye ni anataka kuwa father, anataka kula kondoo. Hata yule anataka kuwa kasisi, anakula kondoo. However, again, we are not homogeneous. I expect there will be some elements of descending among ourselves. I want to ask you, if that spirit enters you, Yombe, pray for it. We can be able to deliver for our people. With those many remarks, hiyo mnyinyi ndio mlisema SHA. Ngine, shida ngine? There is somebody saying, UHC, mko hapa? Ama wako? What about them? Somebody talked about it. Okay. Yeah. They go back. Are they still on? It's from national government. Yeah, I'm told that most of those people, they were people from national government, isn't it? They are on contract. And again, that one is something that I am sure the government of Honorable Dr. William Ruto is addressing UHCs. I know there is a program which is coming to an end. This one for American. What is its name? CDC. And we have been asked to see if we can absorb them. We're going to see how, when, how much is there for them to be absorbed into the system. Therefore, for our brothers and sisters from UHC, you can be sure that at any given time, if there is a renewal of your contract, I'll be at the forefront, making sure it's renewed. Here you can take it to the bank. I can tell you, and I'm told the ministry is in the discussion on how in the future they can absorb all of you into the system. Lakini ubaya ni kwamba wengine mtafika retirement kabla ya kufanya nini? Don't worry, you will be able to take care of it. Anybody with anything? Chris ni ngoja, hiyo utaongea baadaye. Wewe sio daktari, ngoja ni madaktari wangu. Na mtibu Christine. Mtatibu Christine kama kuna kitu Christine. Utauliza hiyo baadaye. Sasa hii ni watu wangu, wewe utauliza hiyo. Anybody with anything? Kando na Christine. Yes? Huyu muungwana anacheka anaangalia chini. Next to the lady. Kuna kitu? Huh? Hakuna. Sasa. We can leave it there. I'll have a meeting. SMH zikuja hapa. Najua nimedrive, sijakula hata lunch, nimedrive kutoka Nairobi mpaka hapa. Congratulations. Lakini nyinyi it was 3. At 12. Hata maji. By the way, nyinyi mtawezaje wacha? Na kama singesema kwamba sijakula. Hebu kuja hawa madaktari kujeni. So that I introduce them. It's important you know these people. They may come to your facility. There are many of them. Dr. Monda. Dr. Monda is in charge of Keumbu Hospital. Daktari si uko Keumbu? Uko, si ndio? Naambiwa kwamba ulikuwa unalilinguish hiyo position. Bana, I will make sure kwamba nimekusaidia. Who has taken over? Nobody. Kuna daktari nitataka ushikilie. Ni kama unajisikia unataka kurudi hapa headquarters, we'll definitely bring you back. Sir, Dr. Monda is in Keumbu, but I'm told he has some reservations which we are dealing with. He's a very good doctor. Doctor who? Ragia. Where are you? No, you are in Maran. You are in charge of Maran. Congratulations. Kwa sababu pia nimeambiwa umefanya kazi nzuri sana. Is there improvement? Watu wa Maran mko hapa? There is. Daktari, continue with the good work. And your mortuary, has it been fixed? What and what? No. Nipe wiki hii kabla ijaisha. It must start work. Sir. Hizo tu. Hiyo Maran. Mocha. Nione kwamba imefanya kazi. Mota kama imekufa hiyo iwekwe mochari nyingine ile. Sasa. Yeah. Dr. Wanaina, she's in Kenya. She have not moved. Dr. Kenya, Dr. Wanaina. Yeah. Kenya had a lot of issues. We had even some watchdogs ambao were interfering with the hospital. But with the administration, I'm happy with that. Ni mama, ni daktari ambaye anajua ni nini anafanya. Let us give them the support. Dr. Wanaina, who is unaona ni yeye peke yake. Where are the other doctors, ladies? Sasa ladies, vipi? Nyinyi ndio mmeangusha Aris kule America. Of course, Dr. Dr. Mtonga. I was with there is a gentleman called Mtunga. Tulikuwa na yeye counselor ndio nakumbuka. Mtonga at his facility. Revenue was at 70,000. Since I deposited me there, I may improve from 70, now he's doing 300,000. Therefore, you expect again service to do what? To improve. Daktari, congratulations. Wewe uli improve wakati ulipata kutoka ngapi mpaka ngapi? You were 700. Daktari, and now we have fixed. That facility, I'm told it has been painted. Renovation is going on. And the theater is working. Good. Thank you. Thank you, Dr. Mkamba. Which facility are you in? Nduru. Nduru, ikoaje? You are in charge of that facility in Etago, and now, now it's good that I'm talking about Etago. You know there was theft in Etago. I don't know. Si yule mtu yuko, huyo mtu alikuwa ameandika hizo check yuko. You transferred him from there. He was supposed to be okay. Sasa, Daktari is in charge of Etago and Nduru. That's in South Mugrango. I hope you'll be able to fix our people in South Mugrango wakishe kwamba wamepata the services that others are getting. Again, niko na waheshimiwa kutoka South Mugrango wako hapa. Yeah, wako hapa. Daktari, which facility are you in charge of? Jesus. 2 months. Nani alikuwa huko? Where is he? Oh. We are renovating. We are finishing building that facility. And that facility, this lady, I think, were you the one who was there before? Yeah, she kept it clean. Ukitoka nje unaona ni mzuri, lakini ndani ndio maajabu. But again, we are fixing. Actually, I saw it to have been advertised. It's there. We are going to make sure it works. And you did a good job. Thank you. Kwa hivyo daktari, Kang'ethe. Endelea kazi nzuri daktari. This is Nyamache. Moset. How is Nyamache? Is Moset doing good work? Yes. Yeah, daktari, I admire you kwa sababu again Nyamache we made sure even there is solar. Now kawaida huko safi, you know, huko kwa suit. Mzuri. Daktari Guto Ogembo, wewe sasa fika, if you are a 6, fika 10. We over service. Actually Ogembo, I went there one night, nikapata kina mama 25 wanapata watoto. One night. Therefore, daktari endelea na kazi nzuri. Let us give services to our people. And is in charge of Bomachoge Church, as it were. Not only Ogembo. There is Misesi. Isn't it? You are in charge of Nyamache, Acheki. All facilities in Nyamache sub-county. Obasi. Daktari, you are in? Yabe is doing badly. Let us agree. But nimeweka mpaka cabros. Zinafanya. Samora was there. Samora has gone for studies. Okay. Yabe, we have to make sure it has improved. It's on the main road. Lazima ifikie Keumbu. Kama Yesu fikia hii. We have put more resources in it. Whether you are in charge ama you are representing somebody. SMH mwambie, I want that facility again, na hii ingine inaitwa Rihanna. Ndio? Yes. We are opening Rihanna soon and Musocho, that they are fixed. Mimi najua tuko na mkutano ambao tunafaa kuwa nayo na inulia bendera ile na kazi nzuri. Yeah, asanteni. Na wewe kama unasikia uchungu, fanya kazi nzuri, we will give you responsibility. Hapa. With those many remarks, Mungu awabariki nyinyi, mkuwe na jioni njema. Tuendelee kuombeana. Tufanye kazi, tusaidie our people. Kisii. The union officials, tafadhali kujeni hapa. Hawa ndugu zangu nyote.